Yes, I, fellow listeners. Once more, this is Kasapa Radio for you, It's a Friday night. And as we always do it, health talk. But you know what? We're getting our boogies on. Ow! Huh? Huh? Woo! Yes, sir. Just as I'm saying, we have a good one for you today. And our doctor is right here. Dr.Charlse. Looking all beaming and handsome, Smiling with everything that he has, He makes me very happy anytime I see him. And today, what we're going to talk about is prostate cancer. Whew. The name scares me. But you know what? We don't have to be scared because it's going to give us all the details of it. Teach us to know the right words, the right things to do to prevent it. And so I know we're all going to enjoy it. So let's stay tuned. But before then, get it done. Woo! A little bit of the music. Pierre, if you're listening to me, brother man, this is your song. I know that, yeah. Yeah. Keep listening to Kasapa. That's how we do it. That's how we do it. That's how we do it. Woo! Good exercise down here. Woo! Yeah. And as I always tell you, our brother Maxi, respect to you, brother man. I hope the next time you'll be sitting right here chatting with Doctor. Yeah, we miss you, brother man. We miss you so much. Get it down here. Yeah, man. Okay, doctor, good evening once more.
Good evening, Virus.
Yeah, Sai, how are you doing?
I'm doing great.
That's good. That's good. Yeah, every time.
It's good to be here with you.
Yeah.
Yes.
As I'm saying, doctor is down here with us. What we're going to discuss today is prostate cancer. Prostate cancer. And I know, doctor, we have a good one for the listeners today. That's right. We always do. We give nothing but the best. And so, yeah, that's what we're going to do. Once more, I say welcome.
Thank you very much.
And I hope today is going to be just as always. You make it special and you make it fun.
That's right.
But I will also tell my listeners, if you're not listening, or if you're listening, call a brother or call a friend. Tell your friend that this is what we're doing. Kasapa brings you nothing but the best. Good health talk. We all need the health talk. Especially this modern era where diseases and the food that we eat are all canny and frozen food. This is what we need. So, once more, welcome, doctor. Let me start by asking, what is prostate cancer? What is prostate and what is cancer in the first place? Yeah.
I think that's a very... Thank you very much for that question, Black Rose.
Yes.
I read a quote from a gentleman, Warren Buffett. He said that we have one body, and we have one mind, and that's the only thing we have that will last with us forever. Yes, and that we should look after our body and our mind. Yes, the Bible teaches us that we should guard our mind. But prostate cancer, before I start with prostate, I'll just talk a little bit about the prostate gland itself.
Okay.
Yes, so that we talk from there. Where is the prostate gland? Where do you find the prostate gland? Tonight's talk is going to be more focused with men. For men.
Yeah.
Yes, the ladies are not, they don't have prostate, so we are talking about men. And most especially men of Afro-Caribbean origin.
Yeah.
So that is the target group. And I just hope those who are listening tonight, they should just, if they have any questions, they can send it through to the
station.
Station.
Yeah.
But the prostate gland is a very small gland that sits under the bladder.
Okay.
Yes. And basically its function is to secrete proteins and ions into the seminal fluid.
Yeah.
You see, when the male ejaculates, it has the sperm and the seminal fluid. And the protein is used by the sperms.
Yeah.
Yes. So that is basically the function of the prostate gland. It's a very small gland that sits under the bladder.
Okay.
Between the bladder and the back passage. So when you talk of prostate cancer, just like any other cancer, it's a multiplication of the cells within the prostate gland. Yeah. Before we move any forward, I think we need to get a good understanding of the prevalence. Yes. And the Prostate Cancer Foundation says that black people are more inclined to have prostate cancer compared to the Caucasians by 1.6, the ratio of 1.6%.
Yeah.
And also, not only that, we have 2.4% at risk of death from prostate cancer compared to the Caucasians. So we are at high risk. The blacks are at high risk. At the moment, the former Vice President Joe Biden he has a foundation, and he is looking the foundation.
Former Vice President of America.
America, yes, under Barack Obama,
yeah.
President Barack Obama. He has a foundation that is actually looking at why is it that it's so prevalent. Prostate cancer is more prevalent within the black community.
Yeah.
So that research has been going on. Yes, but in the UK, actually 1 out of 8 men throughout our lifespan will end up with prostate cancer.
1 out of 8.
Yes.
Men.
In the UK, and will end up with prostate cancer. In fact, it is even much more serious because if you think about the black community, it's 1 out of 4. So 1 out of 4 will end up with prostate cancer. So it's something that this talk, I just hope and pray that those who are listening and those who are over 45 should actually take it seriously. Yes. So it's something that's very common within over the 65s in UK, over 65, yes. And it's less common within
the Caucasian.
Less common compared to the blacks within the Caucasian community, but also in terms of less than 50 years of the Caucasians, yes, in the UK.
Okay.
But for the blacks, 45 is something that you have prostate cancer. So we have a much lower or earlier age, younger age, being diagnosed with prostate cancer than the Caucasians. Yes.
If I may ask, why that rationale? Why that turn of events? Why is it that dominant in the black community? Is it because of what we eat, or I don't know? But why?
Honestly,
why do we have...
I've not seen any literature why that is
dominant.
Yes, it's predominant within the black community. As I said, I looked at Joe Biden's foundation, and they are doing that research why it is most common in the Afro-American men. So to answer your question, I don't know myself. That is something that we are at a much higher risk. Yes, at a younger age. Besides that, compared to the Caucasians.
Okay.
So it's something that I think for the African, he has to take it very seriously. If you're 45, we have to take it very seriously. Yes.
These kind of stuff normally numbs me up because, we'll definitely get there. But just as doctor is saying, it's a very important thing that at least we, the people of color, if I may say, should take it pretty much important as.
That's right.
But if I may ask, how is it affected? Like, how do you get prostate cancer? How do you get it?
Thanks very much for that, Black Rose. The cause actually is unknown.
Okay.
The cause of why these cells multiply, we don't know. However, there have been associated risk factors. And one of those risk factors I mentioned predominantly is things like age.
Okay.
So age in the UK, over 65 to 75 years, they are more predisposed to have prostate cancer.
Okay.
In the black community, as I said, over 45 years. In the Caucasians, less than 50, very, very rare. So age plays a very, very important role. The other thing that is very, very important is ethnicity.
Ethnicity?
Yes.
Okay.
And that is where, as I said, in UK, 1 in 8 men will have prostate cancer, but in the black community, 1 in 4. So just being black, you are predisposed to have cancer at one point, at one stage in your life, in a lifetime. Yeah, so ethnicity plays a very, very important role to that. And as I said earlier, not only is it happening in the older age, in the Afro-Caribbean, yes, it's much younger, about 45, you may have prostate cancer. And we've seen cases of 45 years old having prostate cancer. So, as I said, the cause of cancer, just like any other cancer, why these cells tend to multiply, there are so many speculations that will not go that, but we've not been able to identify the cause
of it.
Yes, that's right.
What about hereditary? Does it come in play?
That's good. That's true. Yes. In fact, hereditary is another very high risk factor. So if you have a situation where your dad or your brother has been diagnosed with prostate cancer, the chances of you having prostate cancer is much more higher. And in fact, when I read about it also, they said even if your mother or your sister has had breast cancer,
there's a likelihood.
Yes, there's a likelihood that you have an increased risk of prostate cancer for the men. Yes. So you have a situation where if you are a black and any of your either your dad or your brother has or a relative has been diagnosed with prostate cancer, I will suggest and strongly suggest that if you are over 45, you actually see your GP on that. In fact, the UK prostate cancer, they have a over 45-year information pack for Africans.
Okay.
Yes, that you have to read about it.
Yeah. I think I should. Yeah, I should. And let me remind listeners, just as Doctor is saying, the UK Organization for Prostate Cancer have a pack for Africans over 45. So
information pack.
Yeah, there's an information pack out there. So I'm urging you all to have a look at it. Just read through, see what it is. So yeah, if you're listening to us, the number to call is still Kasapa Radio. So if I may let viewers be aware, the numbers to call, if you want to call, it's 0195 229 1391. The number again, 0195 2291 391, in case you want to call. We're also on Facebook Live, and it's Kasapa Radio. You can just go there and put whatever question that you want to ask. And if you want to WhatsApp, WhatsApp us, it's 074 3893 8592. I'll say it again, 074 389 38592. Please do bring your questions out, because this is a killer, and especially for we the blacks, it's a highly risk killer for us. Doctor is here giving us all the stuff that we need to do to prevent certain things from happening to us. I think it's a very important thing that we listen to Doctor. We're still on the topic. We're still discussing. Keep your questions coming. Bring out your views. If you have other opinions about these things that we're talking about, bring it out. Bring it out. So, Doctor, let me ask you another question, a little bit different.
Okay.
Do we have grading systems in that disease?
Yes.
And tell me a little bit about how they affect us.
We definitely will talk about the different grades. We have the mild, the moderate, and the severe. Okay. And it's called the Gleason score grade. And we'll talk about that. But if I may just go back a little, just one last thing regarding the risk factors. Yes, diet too. I mean, no, yes, even diet, yes.
Diet?
Yeah, diet has a role to play. It's been implicated as a risk factor for prostate cancer and even obesity. So obesity, actually, not that is a cause or it's a very high risk factor, but it plays a very important role in terms of the advancement of the prostate cancer. Yes, we can talk about things like what could be the symptoms.
The symptoms.
Then we'll now talk about the different grades.
Okay.
Yes.
Okay.
So if we talk about the symptoms, and the reason is that the symptoms, some of the symptoms are subtle. As we grow older, there is the chance of a prostate getting enlarged.
Okay.
So it's called a benign prostate. So you can have prostate problems, but benign. When the prostate is enlarged, it's non-cancerous.
Okay.
So it's enlarged. And then you start having problems with things like dribbling. You go to pass urine, after that you sit, you tend to dribble. So it could be one of the causes.
Hold on with that dribbling. Yeah, if you talk about dribbling, yes, explain deeper before we go to the next one. Explain,
your urine flow has to be a stream flow, isn't it? But yes, sometimes you go and you pass urine and then you just see you see
it doesn't come like, normal
flow,
as it's supposed to come, like, but
yes, that's right. And as I said, if you look anatomically, the prostate is sitting under the bladder. Yeah. So sometimes when it gets enlarged, what it does is it now pushes on the bladder. Yeah. And okay. Yes, and then you may have urgency, things like urgency. You feel like you have to go to the toilet. Yes. So those are subtle symptoms that you have, and also things like incomplete emptying of the bladder. So you feel as if you. Okay, you feel as if you've been to pass urine, but you feel as if you're not fully emptied your bladder. So you feel as if you want to go back and pee again. So that feeling of incomplete emptying of your bladder could be another symptom.
Yeah, because what I know is that the more water I drink, the more I want to go to the toilet. Yeah. So when does it play a likelihood to, prick your mind that, you know what, you need to check it?
And that is what I'm saying.
Because I don't want to mistake myself for, that.
Because you're drinking
too much water. Yeah.
Yes. Then you look at other things like how many times you wake up at night.
Oh, yes, okay.
Sometimes you tend to wake up a little bit more often. Yeah. Than usual to go and pass urine. Okay. Yeah. So basically that's one. And sometimes some people, they present with erectile dysfunction. Erectile dysfunction is that they don't have they have problem having an erection and sustaining an erection. So that could be just a subtle presentation. Yes. And as I said, you may have these symptoms and you said, well, you look for excuses or you. Yeah. But as I said, at the end of this program, what I want to draw into our consciousness is that if you are black, you are 45, and you have a high family history or risk of family history of prostate cancer, then you should not take these subtle symptoms lightly. It's always good you consult with the doctor.
Listeners, there's a saying, but I don't know how to translate it, but you're hearing it from the horse's own mouth. If you're black, within the ages of 45 to 50,
45 and above,
45 and above, let's say 45 and above, and getting these symptoms, or if your family, there's a prostate running in your family, then you've got to be careful. That's all that I'm going to say. Then you have to, so I'm saying it again. That's what doctor is saying. If you're black, 40 and 45 and above, and this prostate cancer runs in your family, better get yourself checked. It is important. Doctor, please go on with the symptoms, some of the symptoms, before we get to the grading, the levels to which we can.
Yes. Yeah. So it doesn't necessarily mean that these symptoms may exclusively be prostate cancer.
Okay.
As I said, you may have a benign enlarged prostate, which of course, yes.
That's a different story.
It's a different story, yes. Or you may have an inflammation of the prostate, what they call prostatitis. That is also, it may also present with this sort of symptoms, but it's always good to err on the cautious side. Yes. For people who already have maybe some sort of advanced prostate, you may have low back pain. Oh. Yes. So you may just be having persistent low back pain. You're taking painkillers, maybe helping to suppress the pain. But sometimes when the prostate has actually metastasized, it's gone out of, yes, it may affect the bones. Presentation with low back pain will be another presentation.
Okay.
Yes. So those are very subtle presentations that most people tend to have. Yes. And what do you do when you go to see a doctor now? The doctor, in this country, there's a test called PSA. Yes. Prostate-specific antigen. And the PSA is just like a protein that the prostate secretes. Okay. I think in America they use it for a screening test, just like screening for prostate. Yes, but here it is it doesn't fulfill the screening criteria. So you cannot use the PSA alone, except if it comes back very, very high. And this PSA has a range depending on your age. Yes. So if, let's say, you are 45 and your PSA comes back at 30, as high as 30, then definitely we'll be sending you to see the urologist, the consultant, to actually make sure that that there is nothing untoward. So
what he said is PSA.
Yes, the prostatic specific antigen.
When do we say it's low and when do we say it's high?
As I said, it comes with range, age range. Okay. Age ranges, and as you get older, it gets a bit higher. Yeah. So you have to look at your age range bracket. So when we get the reports, they usually tell us the age range.
Okay, let's give an example of a 45-year-old person. What range will the person fall into?
You'll be talking about maybe about 2. Yeah,
2.
Yes. So you can have it as low as 2. But if a 45-year-old gentleman comes to see me and his is 30, then that's
extreme.
Yes, that's
comparing
extreme,
to
yes. So that is it.
Yeah.
And so you look at the age range, and it's in different age brackets. And if it's high, then you now be thinking, okay, we tend to do a rectal examination. That's to examine the back passage. And what we'll be looking for is we'll be looking for the consistency of the prostate, whether it's smooth, whether it's rough, or whether it's nodular. Yeah, so we'll be looking at all those things. Prostate, whether it's enlarged, whether it's tender, it's painful to touch. All those are things that when we do a rectal examination, we'll be looking for. Okay. Yes. And then we'll now put everything together. However, if you have a rectal examination, yes, and you have to allow some time, about 2 weeks before you can do the PSA test, because sometimes what it does, it can give you a false reading. Yeah. So it's either you do the PSA first and then do your rectal examination later, or you do your rectal examination and then wait for another 2 weeks to do the PSA, when things would have settled. Settled down. Yes, that's right. Settled down.
Yeah. There's all these stuffs are good, it's just mind baffling because it's also a cancer. Yes. But let me ask, the stages, does it go up? Like, can a person start from, I don't know which one is high though, but can a person start from probably stage 1 and end up at stage 3? Or
Yes. So the staging, actually, there are 3 areas that we look out for, and we look at the tumor itself, and we look at
the prostate tumor itself.
Yes, the tumor
attached to the prostate.
Yes, that's the cancer itself. The tumor, the cancer itself. We also look at, when we want to stage, we look at the lymph nodes. Yes, The lymph nodes are, we have them all over the body.
Yeah.
These are the system that, in terms of lymphatic drainage and lymph nodes, they react.
Yeah.
Yes. Sometimes you can have a spread to the lymph nodes, and then finally we have what they call spread to other organs
in the body.
And spread to things like the bladder. As I say, it's close to the prostate. It can spread to the things like the bone, the back, as I mentioned earlier. It can spread to the prostate wall. Yes.
But does it affect also the pelvic?
Yes, the pelvic wall. It can affect the pelvis. Yes. So you can have the spread where now is out of it's out of the prostate gland itself, and it's affecting other organs. So it's called a TNM staging.
TNM
staging. Yes.
Staging. Yes. What is that abbreviation?
So the T for tumor, that's the
tumor
cancer itself.
Yeah.
N is for the lymph nodes, and then M is for metastasis, if it's gone beyond and affect the other organs. Yes.
So that means that it can rise as it goes.
Yes.
But can it come down as well?
Well, I think with treatment, actually, you want to contain it. Depends on the stage that you pick it up, isn't it?
Yeah, of course.
Yes. So if you pick it up, because sometimes, for example, okay, we'll give an example.
Yeah.
You go now and the doctor now says, okay, you have your prostate.
Yeah.
Yes. He's worried or he's concerned that you did further investigation. After doing a rectal examination, doing the PSA, PSA is very high. He now sends you to the urologist. They now may want to do what they call a biopsy.
Biopsy.
Yes, because sometimes it's only the biopsy that will tell you how we'll be able to make that diagnosis. Because sometimes, even with all the tests that we'll discuss about, we may not be able to pick it up. Yes, so the biopsy will be able to tell you
exactly what.
Yes, exactly. Yes, the same. But after the biopsy, you can have. We have the MRI scan.
Okay.
Yes, the MRI scan, and we also have things like CT scan that they do. And CT scan will tell us about the spread of the tumor and whether it's affecting the lymph nodes as well. Then we have what they call the PET scan. These are all different scans that you can use to actually identify, and then the bone scan to see whether it's affecting the bone.
The bone as well,
yes. So you have all this scan, and it depends on the stage at which you're presenting. Yes,
has gone high.
Yes.
Okay.
So that's it. And even in terms of the staging, as I said, the tumor starts from T1 to T4. Yes.
Okay.
So T1 is when it's just within the gland itself, the prostate gland.
Yeah.
Then T2, when the tumor is now extending to the boundaries of the prostate gland, to the capsule of the prostate gland. Yes, but it's not actually gone out of the prostate gland itself. So it's so T2. T3 is when it is gone to the seminal vesicles. Yes, and then T4 is when it's spread to things like the.
So that's the extreme level.
Yes, the bladder, the pelvis, and also maybe to when the tumor has gone.
That's when you feel the extreme pain.
Yes.
On the lower back.
Yes, and then just like the M, metastasis. Yes. So you can have MO is not metastasized, or M1 is metastasized to the bone. So you can have T2, N1. So that's different stages.
Okay. It's wonderful though, but it's really interesting. It's really interesting to know some of these things because go on.
I think that as I said, is the man's problem. Just like we've discussed about breast cancer in the past. Even though some men may have breast cancer, but hey, the prostate is there for it's a man's issue.
It's a man's world.
It's a man's world. Yes.
Yeah, thank you. Prostate is a man's world, just as breast cancer is a woman's world. But that's why we men needs to be very careful. That's why we blacks needs to be extra vigilant. That's why people within the 45 range and upwards needs to be extra conscious. And that's why if it runs through your family, you've got to be careful. That's what I say. And so consciousness is, awareness is what we're trying to give to listeners. And that's why the doctor wastes his time to explain all these things into details, into in total, like into deeper ends. We need to listen to what he's saying, because this is, as I always say, free of charge consultation. If you come to his office, he's not going to do it that way. So bring out your questions. I know sometimes people like asking questions after the whole thing, but yeah, it's still questions anyway. But for now, he's here with us. How is prostate cancer treated, if there is any treatment to it?
Yes, there is treatment. One, if it's something that is contained within the prostate, is localized, you can do surgery. So surgery is an option.
Before you, the treatment, is it with the stages, or any of the stages can be treated?
Yes, any of the stages can be treated.
Okay, now
and the treatment will be designed depending on the stage at which at which you've been diagnosed. So if it's something that is very localized, you can just remove the cancer, the tumor itself, and then maybe sometimes radiotherapy. Yes, so radiotherapy, we can have surgery, we can have radiotherapy, and we can have some sort of hormonal treatment that they give actually, mainly for people with some sort of advanced stage cancer. Then sometimes you can have just palliative. For those who have gone is actually spread. There is very little that you can do. You just have to manage the symptoms, the pain, and then sometimes you manage it by giving some sort of palliative radiotherapy. You can also use you can plant a seed, a radioactive seed in the prostate, and it just releases radioactive
slowly.
Yes, slowly, and that can be the treatment. So those are ways that they can treat it depending on the stage
to which the prostate has gone to.
Yes.
Wow.
So that is
yeah, that's how it's treated. So does prostate cancer affect does it cause erectional dysfunctioning?
Yeah, as I said, sometimes the presentation may just be that.
Oh.
Yeah, so if a young man of 45 comes to see me with an erectile dysfunction or problem sustaining or having an erection, I need to look at the prostate and make sure that there is nothing, it's not a cause, it's not a contributing cause to that.
What about urinal as well?
Yes.
Is it a major factor? I mean, is it a major thing to worry about?
And I didn't get that.
No, I mean, does that? I'm asking if all these diseases are due to prostate cancer.
Yes.
With the urinal thing.
Yes. The urine is quite interesting. You've asked that, because also one thing that I missed in terms of the presentation, you may have blood in your urine. Yeah. So when you have blood in your urine, it's another symptoms of it.
Yeah.
And not only blood in the urine, you may also have what it calls blood in your sperms.
Yeah.
Yes. So you may have blood in the sperm. So that could be another presentation.
Okay. There's a question here. It says that does prostate cancer does prostate cancer have something to do with how you often have sex, like the frequency of your sex? Can it?
No. Yes. There is no evidence that links how often you are sexually or how active sexually you are to prostate cancer. No, there is no. I have not seen any literature to that. Yeah, so It has nothing to do with how often or how sexually active you are. But as I said, if you are having a problem with an erection, I'll be more concerned. Yes.
Okay. But for instance, when you were young, you had lots of sex. Like, is that a possibility that you might get a prostate cancer when you grow to that level?
No.
That's
no,
not the
no. Yeah, I think when we are young, our testosterone levels are high.
Yeah.
Yes,
our hormones gets.
Yeah. By the time our testosterone level starts dropping.
Yeah. Another question says that does sex position also contribute to getting prostate cancer? Like sex positions?
No, it doesn't actually. So the gentleman who asked the question should be relieved with that. It doesn't cause prostate cancer. But however, if you are 45 and above, and you have a family history of somebody who has been diagnosed, either a brother or your dad has been diagnosed with prostate cancer, and you are in the UK, then it's very important you consult with your doctor. Even if at all you don't have the symptoms,
you need to.
Yes, you need to consult. It's always good to consult.
Safety first.
Yes, safety. So if you are 45 and you have a strong family history of prostate cancer, even if you are asymptomatic, you don't have the symptoms, please do see your doctor and have a discussion with you. As I said, also the information pack is there. You can go to the UK prostate cancer website and look for it. Information pack for over 45 for black.
They have it here also in Telford, don't they?
Yes, you can. It's something that if you can go to the website, I think the UK prostate cancer website, there should be a pack there for the over 45 for black men. Yeah, so you can read the information, and if at all you have any question, then you can now go and have that discussion with the doctor.
With them, Another one says that can one do surgery to replace their prostate at the age of 45?
No, you can't do. They can sometimes you have what they call prostatectomy. They remove the prostate. Yes. In terms of replacing the prostate, I don't understand what it means by. You mean replacing the prostate? No, you can remove the prostate. If the prostate sometimes is enlarged to an extent that is causing symptoms like, as I said, it can push on the bladder, it can affect the back passage. Yes. Sometimes you have what they call benign prostatic hyperplasia, increase in size. Yes. And before, you can just remove it. Now they do even robotic surgeries now. Yes, now they do robotic surgery,
which doesn't take a long time.
Yes, when I was a student, after I graduated, we were doing open prostatectomy. Yes, and it used to be a very awful procedure, but that was years ago. Now it's very refined. So the surgical, and it's very it goes exactly to where it has to be done. So they can enucleate that area, the tumor, and remove it.
So if I'm understanding what you're saying, that it means that all men have prostates.
Yes, all men have prostate.
And what is the use of the prostate?
As I said before, the prostate is just a gland that, you see, when we ejaculate, it helps the muscles, the prostate helps with ejaculation.
Oh, okay.
Yes, so it squeezes to push the seminal fluid and the sperms. Yes, the prostate does what? It secretes secretions into the sperm. Yes, because you see, when we ejaculate, it's not just sperms that you see. You have seminal fluid. Yeah. And then you have the sperms. So yes, so the prostate just produces proteins. Yeah. And ions, secretion.
And when it's damaged, that's when we have all these problems associated. Yeah, listeners, let me give the number again in case you want to bring a question or two out before we finish this show. If you're listening to us, the number to call is 01952291391. 01952291391. And if you are outside UK, you just had +44 to it, and then you can call. But if you're watching us on Facebook, it's also Kasapa Radio, and then that's it. You can find us on Facebook. If you want to WhatsApp us, it's 074 389-385-92. I'll say that again. 074-389-385-92. That's on WhatsApp. Get us and then just bring out your questions. Shout out to Obama Somwa. Welcome. Good evening to you. Yeah, Doctor, back to what we're discussing again. Because it's baffling for me, because as a black person and a person aging toward that direction, you know, it's baffling because I still don't get the drift, but that's what it's supposed to be. So are there certain things that we can eat to reduce the risk, or food that normally shoots the risk higher? Because you talked about obesity being one of the factors.
Yes.
Yeah.
Obesity will talk in terms of maybe what obesity will do is in terms of it will delay. It will delay. How do I put it? Not that delay, but in terms of picking up the prostate cancer, it may actually blur.
Oh.
Blur.
Yeah.
The symptoms in terms of presentation, but in everything, basically, eating healthily is just eating healthily. Yes. In terms of, we should be very considerate in the amount of food we eat. Yes. And we should also be looking at a very healthy diet option. I think that is good for the body itself. Yes, not only for prostate cancer, but for other
good healthy food.
Yes, healthy food. Yes, a blend of protein, carbohydrate, and fat. We blend all those, and then we add fruits. Yes, we take a 6 portion. In fact, now it's a 9 portion.
Oh, okay.
We did discuss about that last time.
Yeah.
Yes, and that. So healthy eating is something that should be a baseline. We should try to eat healthily. Yes, and not only about prostate cancer or breast cancer, but just healthy eating and exercise. Those are things.
Yeah, that was one thing I was going to ask.
Those are things that are within our control.
Yeah.
Yes. So anything can come after that, but hey, we've been able to do what we can do.
Yeah.
Yes.
To this point.
Yes. To this point. Yes.
Yeah. So we need a step forward. We need to push ourselves a little bit more to get to where we're supposed to get to. You know.
That's right.
Yeah. I like the way you mold the whole thing. You position the whole thing to be. And just as I'm telling listeners, this is a free of charge consultation with the doctor himself. Free of charge consultation with the doctor himself. You never get anything like that. Doctor is not going to charge you. It's not going to be free when you go to his consultation table, but he's doing it here. So let's take this advantage and ask him questions and know what he wants to give us the more. You know, I love it. Thank you very much. But what about blood in the urine?
Yes.
Is it a symptom to prick your mind again that, whoa, you need to check it? Because I know there are certain drinks that when you drink, it passes through your urine, and it comes as that color.
Okay. Yes.
So,
so one, blood is not supposed to be in your urine.
Of course, yeah.
So anything that is not supposed to be, then is abnormal. Yes. There are some drinks that may color your urine.
Yeah.
Yes. But if you are having blood, you must question yourself, why am I
having blood in my urine?
Yes.
Yeah, so in that case, what level would that be? Would that be in the stage 1, the beginning level, or it might be a symptom of a higher level?
In fact, if you come with blood in your urine,
or in your semen,
blood in your semen or blood in your urine, I'll be referring you to the urologist.
Okay.
Yes, to examine if there's anything in the bladder or if there's anything in the prostate. So it's something that you have to be referred
to
for further investigation. Yes.
If it comes like that.
Yes.
So
but the simplest thing would be, it's not very common. That's why it's not waterwork infection. Urinary tract infection is not common for men.
Yeah, of course.
And it's very common for women. So if a woman comes to me, a lady comes to me that I've seen blood in her urine, then I'll probably most likely think of infection.
Yeah.
Yes. It is not so common for men. Infection, urinary tract infection is not so common. And it's because of the way our anatomy is
created.
Yes.
Yeah.
So there is a tube that carries urine from the bladder, called the urethra, to the outside wall.
Yeah.
Yes. So that tube is much longer in men than in women.
Okay.
And then the woman's anatomy is in such a way that they are more predisposed. Infection can go into the bladder. Yes. And even in the bladder, there's bacteria in the bladder.
Of course. Yes. Yeah.
So for a man to present with blood in the urine or blood in the semen, I probably would take that seriously.
As a man, yeah.
Yes, and investigate for possible bladder cancer or prostate problem.
Possible
bladder cancer.
Okay.
As I said, the cancer can spread from the prostate to the bladder.
Yeah. So you can't just see a prostate and diagnose whether it's stage 1, stage 2, stage 3.
No, they have to go through all. They have to go through all that. They have to go through the staging process, the TN and TNM.
Okay.
Yes. And you can do that by only using either the CT scan. You can do that by using the MRI scan. You can do that by using the PET scan and the bone scan. So
you still go on the chemo?
Well, it depends on the stage. As I said, yes, it depends on which stage the
prostate has.
Yes, as how advanced the prostate cancer has become.
Okay. There's another question. It says that can men who does not function get prostate cancer? Because the point is he doesn't use it anywhere. So can he or she get a prostate cancer?
Yeah, he can. What if he has a family history of prostate cancer? Oh. Your age, as I said, age is a risk factor. So yes, so if you are within that age group, so yes, if you are within the age group, it has nothing to do with whether you are sexually active or not. So if you are a black and you are 45 and above, and you have a family history of prostate cancer, you may not have the symptoms. I said you should go and see your doctor and have a discussion
at least
with that, so that you know your stand and you know whether you need a follow-up. Yes. And so it has nothing to do with
whether you function properly or not,
whether you're sexually active or not. As I said, the other side is if you are a young man and you have problems with erection, question it. Yes, sometimes people have problems, erectile dysfunction, because of stress.
Oh yeah.
But if it's something else, and we live in a very stressful environment, which of course stress can be a contributory factor to that. Yes, but if it's something that is worrying, they always just I will advise you that you have a chat with your doctor.
Okay. Another question says that what is the definition of black? How here does it include mixed race?
Wow, that is a very good question. The literature I've looked at has not actually looked at it. I think we will look at it from patient by patient presentation. The statistics we've given is just mainly, as I said, I can't think offhand if there's any literature in terms of the prevalence within, or how the incidence within the mixed population. Yes, we've not been able, I don't know about that. But as I said, if somebody is having blood in the urine, if a male is having blood in the urine or blood in the sperms, and is having this sort of urinary symptoms, whether you are mixed or not, I probably will be thinking, is it a prostate problem or not? And if I'm thinking of a prostate problem, I have to exclude a prostate problem, isn't it?
Of course.
Yeah.
Yes. I'm thinking the person is asking because we're saying that it's high in the black community than the Caucasian community. That's why the person is asking, because a mixed race is in the middle of the ocean.
That's a very good question. I think I'll go and try and see if I can look up the if there's any statistics to that question, and I'll give him a feedback.
Yeah.
Yes, I'll definitely look it up and give you feedback. See if there's any literature written.
Yeah, because it's also with.
Yes, we are now in a society where we have a lot of mixed colored people.
Yeah, yeah. So
it's a very valid question.
Yeah. What about I'll come back again into the dieting, eating red meat.
Okay. Yes, they talk about things like low animal fat. Yes, low animal fat will reduce your risk. Yes. So people who eat a lot of high animal fat contents in their food, they tend to have an increased risk of prostate cancer.
Okay, there's a question down here. It says that the North America or Northwest European nationalities, for reasons that are unclear, prostate cancer is more common in North America and Northwest Europe than it is in Asia, Africa, and Central. Is that right?
I looked at the Prostate Cancer Foundation, and what they did mention in that literature, if I remember vividly, they looked about the Caucasians as well as the black community, African Americans. That's the Prostate Cancer Foundation. In the UK, yes, I probably will not know what the statistics is in all part of the world. Even in Africa, I wouldn't know what the statistics is. It may be right that the guy, if it's something that is looked it up and it says it's prevalent in those areas, I don't know whether the migration population in that area, you can think of it as, I don't know the population distribution in America, whether the north and the south they have more. So you may look at it from the migration to those areas.
Is it also because there's a high dominance of Africans or blacks in that particular area?
There is, then yes. If there is, then you may have a high prevalence of prostate cancer within that community. Yes.
Another person is asking, how is the digital rectal examination done?
Okay. Yes. So it's very difficult to explain over the radio. But we use what we call index finger. So the index finger, and it's usually not a very painful, but it's very uncomfortable.
I can imagine.
It's very uncomfortable procedure. But as I said, hey, if you have to have it done, you have to have it done. So the doctor tries as much as possible to make you feel relaxed. People are more apprehensive to the procedure than the procedure itself. So the procedure itself, and they become very tense, and because it's a very uncomfortable procedure. But we try to make the patient relax. We explain what we are doing. We tend to use some lubricants, and then we examine. And we'll be talking to the patient as we are doing the examination.
In the rectum?
Yes, we examine the back passage. But even before you even look at the back passage, you're looking at the back passage, you look for things like hemorrhoids, you look for things like fissures. Yes, before you even start, you start a feeling of the tone of the anal passage, the anal canal, the tone. And then you now start feeling inside. You look for things like mass. They feel for the prostate.
Can you explain a little bit, because we're talking to layman people, especially me. So all these terminologies you use, and can you break it down a little bit to us so we can also understand the whole?
So you start from outside to inside, isn't it? So outside, what are you looking at? Yes, you're looking for things like pile.
Piles.
If the gentleman has pile, you look at piles. You are looking for also things like fissures. Fissures are just splits. Yes, split from the inner canal, split of the inner canal. Yes, it can be very painful, because if it's very painful, then you don't want to. You may cause a lot of pain, because just putting your finger may be a bit more painful. Then now, once you're in, what you'll be looking for, you have a feel of the lining of the rectum. Yes, then you look for it if there's any fecal loading there. if there's feces in the rectum, if it's hard, if it's soft, then you now go through the walls. You now look for any mass. So those are things that we are looking for.
Okay.
If the doctor is doing the rectal examination, and then you now feel the prostate. You now feel if it's smooth
or rough.
Yes, if it's rough. If it's nodular, nodular means you have swellings, lumps all over.
Lumps, yeah.
Yes, and if it's enlarged, yes, if it's enlarged,
like how large it is.
Yes, you'll be able to. And then there is what they call the median sulcus. So there are certain features that we look for when we do a rectal examination.
Okay.
And then at the end of the day, you look if there's any blood stain in the finger.
When you bring your finger out.
Yes, is there blood in it? Yes.
So the blood will signify probably it's open now, or
no, the blood can be from the back passage itself.
Okay.
Yes.
Okay.
And you will know where the blood is coming from.
Yeah, of course.
Yeah. So you probably want to investigate further. Where is this blood coming from?
Yeah. Piles. You mentioned piles.
Yes.
Yeah. Are they symptoms as well? Did they cause
prostate?
Yeah.
No. Piles are just distended blood vessels. The back passage has yes, it is highly vascularized.
Okay.
And with piles, it's just simply that if you have a very hard stool, sometimes it pushes it.
Yeah.
There are 4 grades of piles: grade 1, grade 2, grade 3, grade 4.
Okay.
Yeah. So, but it wouldn't cause prostate cancer.
Yes. Yeah. Yes. Listeners, it has been a very, very joyful journey today. Actually, every time I do this show, I'm so sometimes happy, sometimes tested. I don't know, but it just baffles me every time I do this show, because some of the things that comes, you relate it to your own lifestyle, and you kind of realize that there are changes that you need to do, changes you need to make in our aging system, our everyday life. But just as I always say, it's to your own discretion. Doctor is doing his best to give us the essentials of life, but whatever we do with it, it's our own choice. Yeah. And I'll say thank you very much to Doctor once more. You the best thing happening to us, and we're very grateful for all the job you're putting in for us. My greetings to Mr. Frimpong, pharmacist at Oasis, right? Yeah. Good evening to you.
Give me my regards.
Yeah, Doctor sends his regards. Yeah, we hope to see you also very soon. Yeah. Yeah, but soon and very soon our time is up, and this is Kasapa Radio. We just blasting it out. It's just smooth and moving on. Doctor has been very, 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 very good with us with the explanation of prostate cancer. This is what we did, prostate cancer. And let me remind you a few points that I gathered down here. It says that if you're 45 and above, you're black, and it runs through your family, then you have to be careful. This is prostate cancer. You have to be careful. You have to see your physician. Talk to them about it before it gets worse. Doctor, finally, any small advice on anything that you want to talk to us about? Just few seconds of advice. Should it talk?
I think you've really summarized the message I really want to put across.
Yeah.
Yes, you have really. I don't think I'll do any better than what you've just done. If you're over 45, it's just to emphasize that if you're over 45, you have a strong family history, and you're black, you may or may not have symptoms. Have a chat with your doctor.
Yeah.
I think that is the only message. If there's anything that I'll take home, is that message.
And what about exercising and dieting?
Well, exercise, I'll always be an advocate for good health. As I said, our health is our responsibility. We have been given this body to look after, and it's your responsibility, it's your choice. Look after it very well. There are certain things that are out of our control, but those things that are within our control, let's try to manage them appropriately. Yeah. So, thank you very much.
Yeah, I would rather say the pleasure is all mine. Yeah, thank you, Doctor, so much. And you know what, listeners? Unfortunately, this is where we have to end the show. Woo! Here, this is your song, brother man. I'm playing your song today. Yeah, this song was sung by this guy that I'm mentioning. I know you're listening to me today. Yeah, but before I lose out of this place, I'm telling you, this is Kasapa Radio, and my name is just Black Rose. You know why? Because of the rose that glitters in the forest, the olive rose. Yes, I. Yes, Kasapa still runs on and on and on, you know. Politics will be coming to you right after this show. I'ma tell you this. Chris is ready down here with his panel members. They'll be coming in very soon. Woo! Doctor is here with me boogieing, you know. Getting all the African vibes down here. You know how we do it. This is Kasapa Radio, as I always keep telling you. This and every Friday, we give you health talk. And tomorrow, Mileage Sugar will be down here cruising with the cool numbers. Kofi Amanfo will be also down here, giving us positive hip-hop life, you know. Jamming with us. And in the evening, you know what it is. Reggae night on the dial, you know. Not other man, Black Rose, myself, you know. Chanting down Babylon, rolling with the Most High. Yeah, people, let's go with that. Woo! And again, Kofi Amanfo will be coming to you live after check program on Sunday. That boy is a clacking boy. I will tell you, I love him so much. This is Kasapa Radio once more. In between time, I say thank you for listening to us. May the Most High keep his eyes upon you. May his love shine upon you. May he be gracious unto you. May he make you prosper in all things that you do. Rastafari, I say, God be with you. Thank you very much. Peace out. Woo!